Thank you for joining me today. We are going to be working on our first lecture of our CMI 492 Capstone course. This course is going to evaluate some leadership in the healthcare system, and hopefully, just regardless of your level of employment, your position of employment, whether you feel like a leader or not, we want to develop some strategies and some understanding of good leadership skill to help you on your way, as we know that leadership is an essential component of a successful healthcare system. So hopefully that you will find some of this useful, and hopefully it will help you navigate and develop your own leadership style. So, as Margaret Wheatley says, leadership is a series of behaviors rather than a role for heroes. So because we may not fancy ourselves or envision ourselves as a leader doesn't mean that other people aren't going to look towards us for leadership, or that an institution isn't going to need our leadership. So taking on that responsibility doesn't mean that you are a hero. It means that you might be a hero to somebody because you're fulfilling a role that needs to be fulfilled. Our learning objectives for today are to outline why the study of leadership is important to professionals in the health industry and what some of the challenges in the industry regarding leadership are. We are also going to explain and give examples of leadership as compared with management, and defend why healthcare organizations need both leaders and managers, and then compare and contrast the roles of those two positions. Relate and discuss the application of prescriptive leadership model compared with a descriptive leadership model. Distinguish the phases of leadership thought from ancient to modern times, and identify unique characteristics associated with each of these phases, and map out how that has evolved over time. Relate the phases of leadership thought to modern leadership practices and research, and then evaluate the healthcare industry's need for leadership today and into the next decade. And with your experiences so far in an imaging program, I'm sure you've often noticed the need for good leaders in the healthcare field today. And so don't let the idea that you're thinking that you're not that hero, that you're not that person, sway you away from being a good leader at whatever level you are at. So some of the trends they're currently seeing in the healthcare industry, can be summarized in these 6 key trends. And actually there's 7 here, but a couple of them kind of go together. So the first trend is going to be quality and performance reporting will shift from value add to essential. What this means is that in the past, you may have had an institution that was functioning okay. And so any improvement that you would try to make might add value to what already existed. Well, some of the trends that we're seeing now indicate that now it's not adding that value, it's the changes that are being made are essential for survival. So we've had to go more to that white knuckle approach, dealing with things as they come up rather than looking for ways to improve and add value to the situation. Another trend that has been noted is asset resizing will provide new levers to fund strategic growth. This means that they're going to be needing to take money from certain areas and reapply it to other areas just to keep the levers moving or to grow. And that can be definitely felt in some departments, especially in imaging, when maybe your equipment is out of date, or you don't have as much help as you need, and a lot of that can be due to this particular trend. The third is going to be departmental autonomy will fade as technology enables an enterprise view. So sometimes we see this in imaging where you might have started out a career and had your very own department assistant, you had somebody helping you do scheduling and other tasks right there in your department, and they're seeing the trend to move those people out into a more enterprise position where maybe all of that is done in a central scheduling place now. So they're pulling a lot of resources out of the department, putting them in another place or location or a whole nother department to fulfill a need external to your department. And sometimes those can cause some challenges. Another trend that we're seeing is the implementation of care architecture. So having more people studying how hospitals should function, how medical offices should work, what's going to be most efficient. They're utilizing that new knowledge and that newer study to help drive smarter facility designs to hopefully make the experience of navigation of the buildings easier for patients and workers and the community. Another trend is that effective leaders will be part of policymaking and part entrepreneur. So in order to be really an effective leader, not all leaders will have these two qualities, but to be an effective leader, they're predicting that you really need to have a good, strong background in these two qualities. So policymaker means setting up the policies, imagining everything that could go wrong and making a policy for it, or trying to find ways to create policy to prevent things from going wrong. The other part is entrepreneur, so having that visionary side where you're trying to figure out new ways not to just survive but to add on or add value, like we talked about a short time ago. Another trend is to achieve success in the healthcare industry. An organization must have focused and intelligent effort. As we go forward, it's likely that healthcare is going to become more and more competitive. And in order to keep patients coming in the door, keep people working there, organizations are going to have to make decisions based on good, solid data rather than intuition. Now, intuition can play a role in that, but there has to be some intelligent data behind it to ensure success. And then finally, if all of these trends continue, leaders are really going to have to be the catalysts for an organization, a group, or an individual to achieve greatness in the overall community. Without those great catalysts or leaders, performance, growth, survival can be a challenge. So you think about it, and unless you've ever had a bad leader, you may not recognize the importance of leadership. So it was even recognized as early as 2300 BC that leadership was a quality that people should strive for. And if you can imagine during that time with a lot of disruption and fighting and different types of things, a leader might have been very, very well respected and appreciated at that time. So historically, leadership was admired and it was recognized, and they were intelligent enough to try and study that and see how to replicate it in people, so they had more leaders to help. So fortunately, they've continued that study of leadership over the years, and it's kind of fascinating to see how the leadership thoughts and strategies have changed. We're not going to go all the way back to 2300 BC, but what we'll start doing is looking here at a few different trends that we see in leadership over the past few decades. Here's a couple books that just resources for you if you're interested, that kind of talks about why the study of leadership is so important. So ultimately, the original thought, or what we know of is the original focus on leadership, really started to come about with literature written during the Roman Empire that has then expanded over time and sort of been the basis of where our leadership studies have started. So the need for leadership is essential as healthcare changes. The leaders from 50 years ago are not going to be as effective as a newer leader. Well, may not, I shouldn't say. They may not be as effective as a new leader now unless they've been very dynamic and changing with the times. So the need to continually develop new leadership as the healthcare scene changes is going to be essential. So if we look at some of the things that have happened in the past really decade and a half, or decade to 2 decades, we can see that these have had a major impact on the healthcare communities. So first, in about 2008-2009, Patient Protection and the Affordable Care Act were passed. This completely had some very significant impact on resources available in certain institutions. It had an impact on the number of people that had insurance, where they could use those insurance, facilities, and how they provided their care. So this had a major impact, and for somebody in a leadership position at that time, this would have been a very significant change. Then we went to the ICD-9 transition to the ICD-10. So as you know, the ICD-9 or ICD-10 codes are codes that that code for a diagnosis. And as they had this transition, anytime there's a transition from coding or a medical records process or anything else, anytime we have these transitions, it can come with a lot of bumps in the roads, which this one did. Then we have the explosion of social media from, in the last 20 years where there was no social media, and all of a sudden it is a major impact on everyday life. That's not just of our patients, it has a huge repercussions on the community, community beliefs and perspectives and perception of what a facility is, what their reputation is, and what they're capable of. And so navigating that and trying to turn that into a positive instead of a negative can have a major impact on an institution, and therefore is something that has to be closely monitored and hopefully navigated by a leader. Then we have the growth of electronic medical records and the meaningful use of criteria amongst a constantly expansion of technology. So even when I was coming out of imaging school 20 years ago, most things were on paper. You went and you took you did your ultrasound, or you took your x-ray, and you took the patient's paper chart and you signed your name and you said what you did. And that transition over these last 20 years is that you're rarely going to see paper anymore. And the process of implementing or transitioning to electronic medical records that may have worked or may not have worked was very, very challenging and continues to be challenging today. An increase in community needs, of course, has played a role in challenging the healthcare system. So increased obesity, increased diabetes, increase in other health needs has caused the sheer volume of patients to go up and strain these facilities. And then the necessity and preparedness for planning for disasters. Since 9/11, terrorism has been much higher on the considerations of our healthcare leaders. We also have consideration of more natural disasters. So all of those things, all of that has to be planned for well in advance, not addressed after it's too late, providing another layer of challenge for a leader. And then reimbursement with value-based purchasing, where now patients are being surveyed for their experience, and sometimes their reimbursement is based on the survey that the patient leaves regarding their care. So that has added another level of probably stress and challenge to leaders, as well as the initiation of lean methodology, meaning that you're cutting the fat. You're trying to be lean, mean, not wasting anything to keep your institution operating efficiently and with as little waste as possible. Now, another thing that has been noticed is that there's been some hints of self-protection and self-promotion amongst professionals in healthcare leadership. It's no longer assumed that the CEO of the hospital or the CFO of the hospital is only in it for the good of the patient. CEOs collecting very large bonuses, mismanaging money has helped lead to this impression. And so now oftentimes leaders are looked at with more suspicion than maybe they were in the past. Another issue is that there's a significant lack of leadership morality, knowledge, skills, and abilities at the individual leader level. Now, some of this can be due to some poor training. So if we look at some of the trends where, say in your ultrasound department, it's usually a technologist in a management or then a leadership position. They started out as an ultrasound technologist. They never got, they know how to complete their ultrasounds. They're great at what they do. They didn't necessarily ever receive the training to provide them the knowledge, the skills, and the abilities on how to lead people. So they can sometimes or often be lacking in that area. They have the skill to be a good worker, but not necessarily the understanding or the ability to be a good leader. Great leadership requires education, training, and experience. So hopefully, as say a senior tech settles into more of a management and then leadership role, hopefully they'll seek out that education. They'll go to extra training and they'll develop expertise over time as they experience new and different occurrences in their site. And it's important to note, as a leader, resources should always be managed. You order the resource when you want it to come. You pay for the resource, you get it. People need to be handled differently. People should be led. They shouldn't be managed. They shouldn't be made to do anything. They should be led. They should be inspired to do anything. So a great quote from the book is that resources should be managed and people should be led. So one of the challenges when it comes to leadership, and if we use my last example of that technologist moving up the leadership ladder, you can probably identify somebody you know based on what level of consciousness or knowing they have about their leadership role. So there's 4 states, according to our text, of knowing. There's the unconscious incompetent. You're incompetent, you're not doing a great job, but you're unconscious of it because you don't know what you don't know. You don't know what you should be doing, so you can't say that you're incompetent because you don't know what competence looks like. Education, training, experience can all add to that. Then there's conscious incompetence. Now you know what you should be doing, but you're incompetent at it. And so again, this might be where you know what you're supposed to be doing. Maybe you've had the education, but the incompetence comes in that you're not implementing it. So maybe mentoring, training, guidance, and experience will help move to the next level. The next level is conscious competence. You know what you need to do. You are competent, but you still have to put a lot of thought process into it. And then lastly is unconscious competence. You know what you need to do. You're competent at it. You're so good at it, you don't even need to think about it. One of the ways you can relate this is when you first started scanning, you were unconsciously incompetent. You didn't know what you didn't know. And so anything that you did seemed fine. Then conscious incompetence was you knew the images you were supposed to get, but you couldn't get them because your skill level wasn't there yet. Then you got to conscious competence. You could scan, you could get your images, but you had to think about it really, really hard. And then finally, hopefully you guys are reaching the level of unconscious competence where maybe you can carry on a conversation with somebody while you're scanning and you're getting those appropriate images without thinking too much about it. You're still thinking for your pathology and all those other things, but you're not having to think about the act of obtaining the image. So these states of knowing really apply to us as technologists, but anytime we change positions, we're going to have to undergo a whole new 4 states of knowing until we reach that unconscious competence. When they looked at some of the major leadership theories in, the last couple hundred years, really, the early views on leadership was that there are some great men that exist and they are leaders. Okay, so they thought that was good, and so they wanted to have more leaders, and so they tried to start determining what were the specific traits of these naturally great men that made them great leaders. And so they really studied those from the early studies of leadership until the 1940s. Then in the 1940s, it shifted just a little bit, where they said, okay, we have great men, they have what we're always seeking the traits of these great men, but maybe it's not something that you have to be born with. Maybe it's something that you can learn a behavior or a style that might help you. So they started researching not just the man, but the style or the behaviors. Then once we get to the 1970s, they kind of shifted again, and they said they attempted to explain effective leadership within the context of the larger work situation. So they said, okay, maybe you have a great man. This is how that great man behaves, but depending on the situation or the context he's in is going to adjust how he behaves more. And so they started studying how leadership could be affected based on the context of the position of that leader. So the following components were typically shared across all leadership theories from really the beginning until now. They said, okay, even that great man, he has a vision. Even the guy that we're looking at, in the 70s and 80s, he has a vision, he has a behavior, and even when he gets caught in a non-essential circumstance, he is still working toward that vision, and that's what makes him a good leader. All of them were inspired by the leaders. They saw all the leaders being good role models. They saw that the leaders were intellectuals, provided and encouraged by intellectual stimulation. They knew that the leaders were looking for meaning in their work. They also knew that for a leader to be effective, that they had to have their higher order of needs met, meaning they had to have housing, they had to have food, or else their leadership qualities weren't as good. They also had to feel empowered, that their decision mattered and that they could make their own decisions. They also had to have a set of high expectations and be able to collectively foster an identity where you're not working as an individual, you're working as a group towards one vision. So just like imaging, leadership is both an art and a science. You can read about it. You can find very discrete details of what you should and shouldn't do, and yet there's a lot of art in it. The art of how you talk to people, the art of expression, the art of imagination, and really to be an effective leader, putting all of that together is going to make you the most effective possible. If you're missing any of that, if there's a gap, then lots of times that you can have issues as a leader. So some of the science of leadership would be having good technical skills. This could be forecasting, it could be budgeting, it could be scheduling, it could even be something as simple as writing. Okay, so if you don't have the actual skill, it's going to be more difficult for people to take you seriously, and you're also more likely to make mistakes that could have a negative impact despite your visionary meaning. Decisions from a science perspective are based more on analysis and data. So you're going to find in this class, we don't just make decisions based on intuition. That might play a role, but really when we make good leadership decisions, we're looking at data to help drive us in that decision making. We also want to look, this part of the science of leadership is going to be developing systems in organization. So having that organization, being able to see a need, develop a system, address that system is considered part of the science. Utilizing experts, helping you develop those systems is going to be essential. And then again, where it comes to budgeting, that's part of the cost control and budgeting and supply chain. All of that is still part of skill or the science. When we look at the art of leadership, relationships, networking. All of those are an art form that can add or boost your leadership. Decisions are based more on perceptions of people. This is where your intuition comes in. Developing relationships and networks will help your organization. That's where your people skills come in. Being an expert on people, that's going to help you lead. That's going to help you make people want to follow you. And then image and customer relationships, focusing on that is an art. That takes vision. So definitely with leadership, these are just a few examples of what makes leadership an art and a science, but you see how you have to have those very specific how ideas and why ideas. And as you guys get into the Start With Why book, you'll hear that talked about a lot. So the science part of our brain has to be the how. It has to do the work, whereas the art part of our brain has to be the visionary. It has to give us the dream. Okay, now here's the next couple slides here are a list of a number of different people that studied leadership and the definitions of leadership and how they changed over the time. This may not be that essential for your learning, but what I wanted to do was kind of show you this pattern that we see. So in 1961, when they looked at leadership and defined it, they said it's interpersonal influence exercised in a situation and directed through communication to attain specific goals, a specific goal or goals. This is basically the leader exercising their skill or desires to obtain a goal. You see that extended here in 74. Leadership is the initiation and maintenance of structure and expectation. So again, that leader is the determining factor. It's all dependent on that one person. 82, guiding an organization to success. That leader is pushing the organization. 84, influencing activities of an organized group toward goals. It's not until we get down here to 1990 where we see leadership is the process of giving purpose to a collective effort and causing willing effort to be expended to achieve a purpose. This is where the shift in leadership changes. It's not the leader doing all the work. It's basically the leader inspiring the workers to do the work. So I feel like this is a very important transition here in the early 90s. And in 94, you kind of see it's going to continue on through 94 all the way to 2009, where they start taking into consideration more social influences, more fostering outcomes. There's some wavering back and forth where it is more leader focused, and then sometimes where it is more focused on the people they're leading. Ultimately, the last example we have here is the ability to assess, develop, maintain, and change an organization culture and systems to meet the needs of an external environment. So here they're looking at skill, or the scientific aspect of a leader, that ability to assess, develop, and maintain. They're looking at culture, which takes into the account the art of leadership. And they're looking at the leader as well as with culture. They're looking at the those being led as well as the external environment or the community surrounding them. Now, if we look specifically at culture, culture is a learned system of knowledge, behavior, attitudes, beliefs, values, and norms that is shared by a group of people. So we all have different cultures. You might have a religious culture if you're part of a church. You might have an ethnic culture if you're, part of an ethnicity or belong to a certain ethnicity or race. You might have a classroom culture, and you most certainly have a work culture. And so what we're looking at here is the culture of leadership in the healthcare environment, which for you guys is going to be your work culture. And that work culture focuses on the knowledge, the behavior, the attitudes, beliefs, and values. A good leader can give a worker knowledge of how to do their job, or ensure that who they hire has the knowledge to do their job. They can encourage positive behavior. By leading, by setting a good example, by role modeling and inspiring, they can help improve the attitudes, of their workers. When the attitude is positive, it's usually because the belief in their mission is positive. And so, and the norms are going to set up what's expected of those people to still maintain a position in that culture. So leadership has a major contributing role in developing culture of a site. Leadership's also dynamic and active. It has to create and maintain organizational culture. It's not something you can work on really hard for a year and then just let it fall into oblivion. It's not going to keep itself going. It's something that has to be continually attended to. It focuses the collective energy of both leading people and managing resources toward meeting the needs of the external environment. It should be utilizing the most efficient, effective, and efficacious methods possible by moral means. And that is a hefty role for a leader to master. So, excuse me, we've talked a lot about leadership, but what about management? So there's a distinct difference between management and leadership. A healthcare manager is somebody that maybe stays more closely coupled with an organizational policies, standards, guidelines, and processes. Now, some people have to be this. Some people have to follow the rules or else everything could fall apart. But healthcare managers are more cut and dry. There's a policy for this, we have to follow it. A healthcare leader is usually over a larger area. So maybe the healthcare manager might be over a department. They have to make sure everybody's showing up for their schedule. They have to make sure all the policies are being followed. And they have to be rigorous in that. Whereas once they move up to a higher level, perhaps, then they get to be more of a leader. They're more involved in developing the ideas, the culture. Maybe these are the CEOs of your clinical sites, where they're they have their idea to organize Nurses Week, to organize Imaging Week, to have a summer barbecue for its employees. Now they have to overlook many, many things, so their involvement in each individual aspect is going to be more limited. They don't have the time to put in that maybe a manager has to put in to focus on one particular thing, but they are more proactive. They're going to be the visionaries, and they are going to have their eyes over a much larger set of considerations typically. So here's an example. So a leader might look over the longer time horizon, meaning a manager might look at data and try and address it on a quarterly, monthly, or yearly basis, whereas a leader may have to look for maybe looking out on a 10-year horizon. They are the vision, then mission oriented. They pick where they want to go and they find a mission to get them there. Whereas management is probably just working towards that mission. They might have a vision, but they may not have the support at that level to help them achieve it. Leadership is looking for organization validity through environmental scanning and intuition. Again, they get to be a bit more of the artists. They're looking at their environment. They're seeing what's good. They're seeing what's bad, and they're taking those findings and they're trying to implement it or address things in a larger scale. Whereas management might be looking at things more, looking at reliability a little bit more. Are we following policies exactly as written? Okay. The leader might look for to see if the organization has the correct components, including people, resources, equipment, expertise to meet not just the needs now, but in the future, and they can start dreaming or making plans of how to adjust that. Whereas a manager is probably trying to make sure that they have enough people to work the next shift, the next week, the next month, 6 months or a year. The leader gets to develop and refine organizational culture, whereas the management is more apt to be maintaining organizational culture climate in evaluation of performance. And the leader usually has more opportunity to affect timing and tempo of initiative and projects, whereas the management are probably the people putting in the work to get those projects done. So healthcare organizations, we need leaders and managers. Leaders and managers have different perspectives. They have different responsibilities. When you get to to start reading Start With Why, you'll find that really these leaders and managers, neither one can be successful without the other. We need the person that's the why, that leadership with the visionary, and we need the person that's the manager or that's going to be the how. They're the ones doing the day-to-day operations to get to make that leader's position successful. Leadership requires predetermined vision on an individual, group, and organization level, and as the industry as a whole, and this can sometimes be defined with a mission statement. The complexity of the leader's actions and behaviors increases as one moves from individual to group to organization, and so on. So the farther up that a leader goes, the more complex and the more considerations they have to consider. Leaders use strategic systems to direct the organization, but people are still led, resources are still mannered. And in this course, that's what some of the things we're going to start looking at. How can you be a successful manager? How can you use the science to direct you in making decisions? As you move up, how do you use those art skills and science skills to become a successful leader over more areas? And so hopefully building some of the confidence in you that you can do this and that you can be essential part of the success of not just our profession, of your department, of your institution. All of that is hopefully something that you can see yourself in at some day. So in summary, leadership has been recognized as a trait for a long, long time and studied and still remains integral to the functioning of business and society, and our views of leadership will continue to change over time. Leadership traits are not automatically known. We're not born with them. They're not innate, but they're developed over time. So we might have a step up if I was born with really good leadership tools and then my behaviors were honed and then my situation was managed. All of those things are going to contribute to getting to a good leadership position in your life. And then understand that there are many different approaches to leadership development. They've been studied and they direct prospective leaders. They also, as we get farther into this text, you'll find that there's many, many different opportunities or approaches to partaking in leadership activities. And so hopefully by presenting some of those to you, you'll find that you have what you need to go out there and succeed. So thank you for joining me for this first lecture, and we'll see you next week.